Schoen Clinic is the family-owned private hospital chain in Germany. We do have 18 hospitals all across Germany and do generate a revenue of around 750 million euros. And the unique and special thing about Schoen Clinic is that we have a very high focus and level of specialization. So 80% of our revenue is actually coming out of orthopedics, neurology, mental health, and some internal medicine. And this is pretty unique because usually hospital chains do offer a very wide variety of medical services. And Schoen Clinic is super specialized, and because we do think that specialization is a key lever for providing better outcomes. Well, the Schoen Clinic was founded 30 years ago by family Schoen. It's still family owned, and we are the biggest family owned hospital chain in Germany. So the first hospital we founded was a mental health hospital. Today it has more than 500 beds, purely focusing on mental health, and by mental health we do mean eating disorders, depression, and again a highly focused and highly specialized hospital with dedicated programs for adolescent eating disorders, depression for policemen, for soldiers. Pretty unique in Germany. And from that on, then we went into neurology with intensive neuro rehabilitation, and then established hospitals for orthopedics, and orthopedics, that is spine and prosthetics. Over time, we managed to establish very well-known and medical departments and centers, and we were able to treat people like Mikhail Gorbachev or the Emir of Kuwait, who most recently came to our hospitals, which makes us actually very proud. I mean, we've been growing in Germany for 30 years now. So actually almost every year, or most of the time, we had greenfield approaches, built new hospitals or bought new hospitals and integrated them. And in the meantime, we have reached a level of professionalism and size that we thought it's a good idea to go abroad and go into other growth opportunities. So that's why we had a look into other foreign markets and came up with our first international hospital, which will be based in Harley Street Medical Area in central London, because we saw that in central London there are very few offerings which are highly specialized. So we didn't find any really super specialized orthopedic hospital in central London. And as we do have a very strong history and history in outcome measurement and quality management, again we saw that this doesn't exist in the private healthcare market or hospital market in London. So we felt we might add a very interesting offering to the central London market. So therefore we're pretty excited to open a hospital in January 2018. There's a lot of competition going on in central London, and I think there are great consultants working here in London. But the thing is that the model, how they interact with hospitals, is pretty different to the way we set that up in Germany. So here an individual consultant will work on his own as an independent consultant. And what we would like to offer is a salaried model where the consultant is actually the employee of the hospital, so that we will build a dedicated team of consultants working together in setting up this specialized hospital and then acting as a team in providing better outcomes. And this again will be a huge innovation to the market. And so therefore we're pretty excited to bring that to London, because we do think that superior quality can be actually supported by having a dedicated team committing to the same level of professionalism, standards and quality management. Of course, we know that this model is pretty different to the way it has been done in the past in central London, and of course we do know that we do have to adapt the models we are familiar with from Germany to the UK or to the London market. So probably there will be some changes and adaptations, but we do think that this element of a salaried model will provide much better outcomes than just having this individual independent consultant model. And that's how we work in Germany. I mean, we do have very few independent consultants in our German hospitals, but the standard model is a fixed salary model contract. At the end of the day, we will probably offer both. So there will be consultants who work on a salaried model, and there will be independent consultants who where we provide admitting rights, and they will work as an independent consultant. And then over time, we will try to increase the amount of people who are on a salaried model.